Hello, my name is Joanne and I'm the Director of Healthy Communities of the Capital Area, one of the Healthy Maine partnerships here in Maine. And I am doing a very brief awareness of the social ecology model and some applications it might have for Healthy Maine partnerships. This is part of a project we're doing as capacity building for the Central and Penquest public health districts here in Maine. So, a number of years ago, all of the Healthy Maine partnerships were invited to a training around the social ecology model, and it lasted all day. So believe me, this is not a comprehensive look at social ecology, but it is using one of the tools that most of us have at hand. Early in our experience as Healthy Maine partnerships, Chris Lyman, who now sits at the Office of Local Public Health, made sure we all had a set of nesting dolls. Now, I'm sure many of you are saying to yourself today, all right, nesting dolls. I've seen one of those on my shelf in my office and I had no idea. I thought it was probably the previous director's whim that she had a set of Russian nesting dolls. Well, actually, they're a tool for explaining the social ecology model. And we use a number of public health models and theories of change as part of our Healthy Maine partnerships. And this is one that the Healthy Communities of the Capital Area uses often. So, I've taken apart one set of the Russian dolls here, and I have it in front of you today. And as you can see, this is the way that they all fit together, and then they all come apart. We have 3 sets of dolls here at Healthy Communities of the Capital Area because on any given day there may be several of us working in the community explaining how we function. And this is a very good explanation of what we do. So, let's take an example of public health change or a Healthy Maine partnership initiative that we might be working on. Let's use me as an example. Now, if I were to say to you that I had decided that the way for me to improve the way I eat is to eat less chocolate, and to say, oh, perhaps the only times that I'll be eating chocolate are at special occasions. And if I asked all of you, who is responsible for that behavior change, I'm sure that most of you would say, well, I am. And indeed, there are interventions that are important to be addressed at the individual level. But let's say just this morning, I woke up and said, all right, there's nothing special happening today. Today I'll eat my fruits and vegetables, my whole grains, and I go to work. And my social network, by the way, is my work site. At least one of my social networks is. I have several. I have the people at my social groups, I have the people at work, and I have the people in my family that I consider my primary social networks. Social networks are important influences on the way that we function. So I come to work today, and there's nobody in my office that's doing anything that's a celebration, but there's a birthday and yet another staff here that share the same building. They have from Slate's Bakery, a double chocolate cake with chocolate icing. They have a small staff. There's half the cake left. And they come upstairs and say, by the way, we have half a cake left. It's downstairs in the kitchen area. Feel free to have a piece. So I walk by once. There's no problem. I go down again to fix my lunch. I can avoid that cake, although it does smell and look delicious. But about mid-afternoon, when I'm having that little slump, somebody walks upstairs, somebody that's important to me that's on that other staff, and says, we really want to be sure that all of you have a chance to have a piece of this absolutely fantastic cake. And believe me, folks, this time it's hard for me to say no. So we have the individual. Yes, I could have said no, but it's important to me about what the people in my social network think and do. Plus, if my social network has the cake here, it's way easier to eat it than if they didn't have it there at all. So let's look at a different day. I wake up in the morning and I'm very busy. I'm a little late. I rush out of the door. I go to work. There's nothing special happening today. I'm not going to eat chocolate. There's nothing happening among my social network folks. But our organization has a meeting this day. And I'm running late. I didn't bring a lunch. I have to go quickly to another meeting. And where are the opportunities for me to stop and grab something to eat quickly. Well, since the organization has all of these meetings, they give people choices about what to have. And we show up and they have, a good lunch, but the afternoon snack is yet again brownies, chocolate chip cookies, and perhaps an oatmeal raisin choice. So here I am, my individual decision this morning, my social network, my organization, which, by the way, folks, is the Greater Healthy Maine Partnerships. And I still am in a setting where I am exposed to and right beside chocolate yet again today. All right. So here we have the individual. One day it's my social network that I really don't want to let down, but also who have provided that cake right in my space. The next day it's my greater organization that has indeed provided chocolate in the afternoon, again during that slump time, and it's very tempted, and indeed I might eat it. All right, so another day, well, let's possibly think about what I would do in my community, because that's the next layer in these nesting dolls, from the individual to the social network, the organization, and then the community. All right, let's go back to the same day that I got up in a rush, forgot my lunch, and decided perhaps instead I would walk down the hill from my office to downtown Gardiner. Now, it's a nice walk. It's a lovely little town. But I go directly from my office down the hill past Fairpoint office, past the post office, and immediately on that corner is A1 to go, A1 Diner, and the bakery. Now, I know that there are some good food choices there, but believe me, all three places have absolutely wonderful choices again. All right. So, are you thinking about this, folks? Is it indeed all about individual responsibility? Or indeed, are we influenced by our individual desires, our social networks, our organizations, and our communities about what's available? If I'd walked down that hill and there had been a great whole food place that had fruits and vegetables, I could have made another choice. And of course, our final level of what influences us as individuals in our behavior and in our organizations, social networks, etc., is what's in our policy and environment. So environmentally, we are in Maine, which means that we don't always have easy access to fresh fruits and vegetables that are local. We now, thank goodness, have better policies around our fast food restaurants being able to provide us with nutrition. But do you think that nutrition labeling would have been at the bakery, A1 to go, or A1 Diner? I don't think so. So that's a way for us to think about that it's not always about individual choice. And in fact, that all of these levels of interaction influence us greatly about our physical activity, our nutrition, our tobacco, and at any point, no matter how good our policies are, if the other pieces are not aligned, then we are in positions of less success in our personal decisions. Healthy Maine Partnerships work on the policy and environment. We work to change what's happening in our communities. We strive to help organizations to have policies and environments that also help support the work we do. And then we rely on our partners to work on individual behavior change and on social network interventions. And that's the reason for the nesting dolls and for the social ecology model. If you look further on our website, you may find longer and more in-depth training opportunities around social ecology model. And if you plug in social ecology in Google or Bing or in Ask, you're sure to come up with other interventions around a number of public health initiatives that also use this model. Thanks so much.